Hi, my name is Dr. Ilya Skolnikov, and I'm a chiropractic kinesiologist. Never heard of that before, have you? Well, what a chiropractic kinesiologist is it's a person who's a specialist at diagnosing exactly what's causing a person's health concerns. So we're going to talk about that right now. There's three causes of any health concern. There's a structural cause, meaning if I were to get hit by a car or something like that, I get side-swiped over here, and then, I have a lot of pain and I have to go to the hospital and that kind of thing. So that would obviously cause a problem with my health. There's an emotional cause. If my girlfriend leaves me and then I'm really upset and depressed, that's emotionally upsetting. And there's a chemical cause, like if I eat at Burger King and McDonald's and that kind of thing, if I eat there every single day, all day long. So those are the three causes of a person's health concern. A lot of people are not aware that chiropractors can treat the causes of people's health concerns and thereby ridding the person of what otherwise might require them to need drugs or radiation or possibly a surgery. And those things are necessary at certain times for certain people, but we all know people who are needing medication, and because the medication is being prescribed for a chronic condition, they may need to use the medication for years and years and years, and many of these medications, as we know, have tremendous side effects and are actually quite toxic. Okay? Over 71 side effects is what they say, and all types of toxicity. And the side effects of these medications aren't actually side effects, unfortunately, they're the effects of the medication. So we're going to go over the Triad of Health. What is the Triad of Health? Well, at the bottom of the Triad of Health is the structure. And most people, when they think of a chiropractor, I'm a chiropractor, by the way, and also an applied kinesiologist, a professional applied kinesiologist. And so they usually think that chiropractors treat structural problems like back pain or maybe some other pain like a headache. And they do. My particular profession treats the causes of the back pain and the causes of the headache and the causes of a lot of these other imbalances that people have. So there's a structural cause of any health concern. There's an emotional cause. And then there's also a chemical cause. And Hippocrates once said, nearly 2,500 years ago, he said, the highest good is to find the cause of the health concern. If a plumber goes to a person's apartment and they know that there's all this water underneath the sink and they're trying to find the leak, and they can't quite find it, but they patch up a bunch of things and the problem goes away temporarily, but they never found the source of the leak, what's probably going to happen? The cause of the leak is still there, the leak's going to come back, and the plumber will need to come back again. So if he could just find exactly where the leak is, that's a good plumber, right? A good plumber is somebody who isolates where the leak is, they patch it up appropriately with the right type of epoxy or the right type of patch adhesive or whatever the case may be, and then the leak is gone forever. It shouldn't come back if it's done the right way. But the key is the diagnosis. The key is to find the cause. Again, if you give pain medication, what is it, Tim? If you give pain medication
for an infection,
it's probably not really going to do the trick. You can give pain medication for trauma. You can give an antibiotic or some type of vermifuge, meaning something that kills an infective agent. You can give that for an infection. But if you give an anti-inflammatory for an infection, pain medication for an infection, because it's not really addressing the cause of the infection can spread and get worse, and then you have a big problem. So each of these areas of the Triad of Health are directly related to each other. If I were to provide a structural therapy, it's going to affect the person's emotional state. Kind of makes sense. In other words, if I have a tremendous pain in my back, let's say, and I go to a chiropractor, and chiropractors are famous for getting rid of back pain, and I was kind of down about the pain in my back, I mean, it was kind of making me just feel just terrible all day long, and all of a sudden I'm in a better mood, right? That helps me emotionally, and I start to digest and my food better and absorb the nutrients in my food. I mean, that's kind of showing how all these things are related. If you choose to chop off my hand, please don't do this at home, kids, but seriously, if you chop off my hand and I'm in tremendous amount of pain and I have to go to the hospital, that's a structural problem. But obviously, I'm going to be really upset that my hand is gone. I mean, I've lost a limb. This is incredibly disturbing. So I'm going to be in pain. Pain itself is registered in a portion of the brain called the limbic system, which is the emotional center of the brain. So pain in and of itself is an emotional experience. You see how they're all tied in? And now that I'm so upset and I have so much pain in my right arm where I've lost my hand, now I'm probably not going to digest my food as well, and it's going to take a huge number of extra nutrients in order to just supply the healing process to take place in that area, because the healing process and the process of inflammation and all these other processes that take place when there's a big change, like somebody's hand getting cut off, they require nutrients, they require specific chemicals. So each of these areas of the Triad of Health are intimately related. And you can't go, well, I shouldn't say you can't. We have the chiropractors and massage therapists and acupuncturists who stick needles into the body. These different healthcare providers address a person's structural integrity. They address the body. Structure means body. Structure means physical. Structure means structure, okay? Like ligaments, joints, bones, tendons, skin, all these things are structures. So they address that well, but many times they don't take into account a person's emotional state when they're treating the structure, or they don't take into account the change in chemistry that happens when they address the structure. And many of the healthcare providers that we see today prescribe great medications or nutrients, but then they don't pay attention to how it affects the person's emotional state or changes their structures. Or psychiatrists, for example, I'm not a psychiatrist, my father was a psychiatrist, but I do emotional therapies with my patients. Psychiatrists will provide these amazing emotional therapies, and they're incredibly effective, but if their patients are still going around eating donuts all day long, they might kill the mayor of San Francisco, for example. That's what happened to Mayor Moscone. He was apparently assassinated by, Harvey Milk was assassinated by a man who was having too many Twinkies, and he got off on what's called the Twinkie defense for some reason. So anyway, so we see how each of these areas of the Triad of Health are interrelated. And it would be good for people to pay attention, if they're healthcare providers, to how their therapies affect each of the sides of the Triad of Health, because that's what a professional should do.